Hey everyone, welcome to another edition of the Buddy Study Group. And I think it's the most wonderful time of the year. I try to make sure this presentation happens once a year. I think it has consistently since we've had this study group. No better person to do it. We have Miss Linda joining us today, who's going to take us through a little bit about field underwriting for long-term care specialists. And as I mentioned in the agenda, um, a lot of the trainings I've done over recent weeks, whether it be helping to save declines, right, and save your cases, or helping to overcome objections, or any of the number of kind of foundational principles of being a long-term care specialist, finding the right product fit, all of those things are helped immensely by good field underwriting. So we've been talking about so many things that are supported by it. I thought it was time to bring this session back around and um, really show you how it's done through Linda coming here to tell us all about it. I know we have a lot of people starting summer vacation a little early, so got a little bit of a smaller crowd, but Linda, really appreciate you being here. Always my favorite session of the year, and you can take it away whenever you're ready.
Thank you. Thank you. I learned something really interesting about the value of having a good underwriting. So, for example, I was on that NGL trip and I only sold 1/3 of what other people's sold. And yet I was in the top 10, right? I got to go on that. And I was actually surprised. I had no idea about how important this rate was until they were around the table. And the first thing that Joe said was, I just have to ask, how do you have a 7% declaration rate? And I didn't know what mine was, and I never really thought about it, right? You do your due diligence, you put the things that you put your applications in, you want to make sure that people don't get declined. And as most of you know, NGL is one of the hardest, tightest underwritten companies out there. So, 7% to me, actually, I don't know if that felt good or not when I understood that the general population of qualified agents is running about 25%.
It's intensely
And
low.
and when you look at financial planners who sometimes have, a 40 or 50% rate because they don't even ask about height and weight or look at height and weight, it's amazing, right? So, one of the values that, as I looked around myself, I said, gosh, at 25%, that would be 1 in 4 that gets declined. That's an awful lot of backpedaling on trying to make a sale, a lot of time and effort, a lot of unhappy feelings from a client. And if you're working as a resource to financial planners, um, are you really doing them a favor, right? I mean, your job as a long-term care specialist is to be that specialist so that their clients are happy all the time. And the way to make them happy is that when they apply, there's a 93% chance that they're going to get their long-term care policy, right? That's what we're looking for. So, it brings huge value to you when you can say, I bring a specialist. I am a true specialist, and one of those things that I do for you is to make sure with everything possible that your client is going to go through underwriting the first time. And they're not going to have that feel bad feeling, right? And you're not going to waste that financial planner's time either, because I don't know how many of you work with financial planners, but I can tell you that the vast, at least 60% of my sales are in partnership with financial planners, which means that I'm often on um, the webinars with them as we talk about product, and I'm sending my ideas to the financial planner, which takes their time. And then we sit back together and we meet with the client. And then we often meet, then they sit down oftentimes with their client to reinforce what I just said. And then I'm back with their client to do the application. And then to have to say to them, oh, I'm so sorry they were denied. I mean, that does not bode well for a great relationship. So it's just really, really important this whole concept of underwriting. And so what do I do? I talk about it as if it's as much as financials, right? I get on the phone and I talk to them. I have a form that I use that they can just fill out. Diane is actually using the new a form
Packer.
that, yeah, pack that you pay for, and she loves it. I'll be evaluating that over the next month, so I can give you feedback on that as well. Um, uh, when I work with a client, I want to know everything, and it's amazing. People give you everything. If you come across as a professional and you are comfortable with asking the questions, they will answer your questions. And if they hesitate, you explain why you're asking these questions. Now, we are not using this information for anything but to help them, right? And if we don't ask these questions, we could be causing harm. So by making this such a difficult process that they have to go through this all over again, and they may not choose to do that, and then they just lost the opportunity for long-term care insurance. You always want to show them what is appropriate for their health, and because if you come back with a product that's going to be significantly more expensive, the chances of them purchasing goes way down.
Hey, Linda, a
Right.
couple things, and I have a question for you too. Number
Yeah.
one, I think the analogy you give that I use all the time is the say yes to the dress. Not
Yeah.
wanting to show somebody a dress that's they find out is later out of their budget from a health perspective or otherwise, and
Exactly.
dealing with that disappointment. But number two, I think being a good field underwriter is the number one way to get introduced to more financial planners, like you were saying, because I think there are many financial planners out there who know long term care and know the market, but because of the nature of their work, they don't want to know intimate details about their client. They don't want to actually participate in the underwriting process with them. Are you finding that that is one of the entry points that you see? I actually don't want to touch the underwriting piece. My relationship with my clients has never had anything to do with their health.
There are some. I actually have a lot of financial planners who are intimately related with they feel very comfortable talking about these things with their clients, and then there are others who don't. So it's very individual in terms of whether they feel comfortable asking these questions or not. Um, but I don't know if everybody knows say yes to the address, because this is one of my favorite analogies, which is saying yes to the dress is a wedding dress program. And people come, and these dresses could be $30,000 or more. I mean, they could be buying a house by buying a wedding dress. I mean, it's crazy. Anyways, they go into this shop, and the first thing the salesperson asks is, "What is your budget?" And if somebody says, "My budget is $10,000 for a wedding dress," they will not show this person anything more than $10,000, because they know that if they show them a $12,000 dress and their budget is 10, they're going to love that $12,000 dress, and they're going to walk out empty-handed because they can't afford that $12,000 dress. Now, if somebody comes in and they say their budget is $20,000 for a wedding dress, then they don't mind showing them a $30,000 wedding dress, because they're already off the charts spending something ridiculous on a wedding dress. So they're fine with giving them, they can give them something that's even greater, and it's not going to impact their budget, right? If somebody has $20,000 for a dress, they can spend $30,000 on a dress. But if somebody's spending $5,000 on a dress, they may not be able to spend $7,000 on a dress. Well, long-term care, it is this feeling in people's minds about what they can afford. And when you talk to people about their individual assets, it's interesting, but I usually find that people will downplay what they can afford versus what the financial planner says they can afford. So I was sitting with a client, and they filled out my form, and I said to them, the financial planner, so I'm pretty much narrowed it down. They're saying they're about 1 to 1.5 million. They don't mind it. They're not worried about a death benefit. They just want to get the biggest bang for their dollar. So I will show them a hybrid, but I think we're going to be focusing more on a traditional policy. Um, and and she says, "What? 1.5 million? They have so much more than that, right?" So um, so always keep back in the back of your mind that sometimes, in terms of finances, people will make their assets less to you because they don't want you overselling them. So if somebody said, I have $6 million, then you're thinking, oh, I can sell them anything, and they don't. They want to avoid that kind of giving the agent the carte blanche to spend anything. So, but if you always show them the cost benefit of their policies, that's when they're much more likely to increase the benefit and the premium themselves, right? So you give them options, and better to have lower price on the choices, and they bring themselves up, as opposed to showing them something too high, like say yes to the dress, and then they say I can't afford it.
I'm
I'm
glad you
just
went into that and kind of peeled that back because yeah, people will give you a budget that is representative, maybe not of their true budget, but exactly how much of their budget, their actual budget that they want you to have control of or to put into this plan. And the interesting thing is when you start to bring health into the picture, your budget's not decided by you at the end of the day. It's decided by underwriters. It's decided by carriers, and that can, in many ways, cap you more than your financial budget can, right?
exactly, exactly. So what I always tell people is when I start out is I always start out with obviously this is a financial product. We need to understand. So it's important for me to understand uh, your finances so that I can help you choose the appropriate product value, as well as how you might pay for this, whether it's a short time or over a long period of time. And uh, and sometimes I'll get pushback, like you don't really need to know how much I have. And I'm like, all right, well, let me ask you, how much could you spend in a year, and that you could feel comfortable spending in a year, so that you could still make it into retirement? They'll look at me and they'll say, well, I don't know. It depends on how much I get. I said, exactly, which is why I need to know if I should be selling you a 2-year policy or an 8-year policy or an unlimited policy, right? I don't know what I should, because I don't know what you can co-fund on this policy. So whatever I give you as a number for long-term care, you have to have enough assets to fully fund the benefit, right? The cost. And if you can't do that, I'm not going to sell you 6 years of benefit if you can only co-fund 2 years of benefit. So let me ask you again. Why don't you tell me what your income is, and are you renting? Do you own? How much the value of your home is? What is your mortgage? And what have you set aside for retirement? And boom, 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 the numbers start to come in, right? Because now they understand what you're doing. And I'll say to them, I can't, I don't even know what to tell you. Just, if they're not going to share you their numbers, they're likely not going to buy. So why waste your time? When they start coming forth with information, then they're much more likely to, now they're invested, and now you're going to be able to work with them and actually help them. So we get through the finances, and then we say, the other thing is we're in a great time. There's a lot of options for long-term care. Generally speaking, the healthier you are, the less expensive the products are. So it's really important for me to make sure that I choose the most appropriate product for you. But the last thing I'd want to do is make you go through all the work of applying for a product that you wouldn't qualify for, because it doesn't matter how healthy, how much you understand it. It always feels bad when you get denied, and I don't want that to happen. So uh, let's start with some questions. I start with their meds, right? And we have their meds. We understand what those meds go to. So if they are taking osteoporotic medication, you need to know what's their T-score. And it's okay to wait for them to find their T-score. The last thing, and you can ask them, did they say it was mild? Did they say it was moderate? Did they say it was severe? Did they give you any indication about how your osteoporosis was doing? And sometimes they'll say, oh yeah, they told me it was nothing to really worry about. It was very, very light, or they can say, yeah, they were talking that it was, could be moderate to severe. We don't really know. So then we need to know, what is that T-score? And it's the highest T-score, I should say, the lowest T-score, because it's a negative. the lowest T-score of any joint that's critical. So they could all be, in the osteopenia range, less than 2.5 and more than 2.5, negative 2.5, and you have one that's negative 3.7, and you're going to start to get into difficulty with some companies. So it's really, it's okay to wait for them to come back with information. That's why you do your interview first. You get all the information that you can possibly get, and you send them an email to remind them, listen, it was great talking with you. As soon as I have your T scores, then I'll be able to, put together some quotes for you. Somebody has an aneurysm, another thing, "Oh, it's just an aneurysm. They're not going to do anything about it." Well, of course they're not going to do anything. They can't do anything for it, but it could, if it erupts, it's a problem, right? So just because there's no treatment doesn't mean it's not a problem. Doctors are not going to stress people out about something that they can't do anything about, right? So they're just going to say, it's an aneurysm. Don't worry about it. There's nothing we need to do about it, which is true, but it could still be a significant problem and can deny them from, the vast majority of companies. So if somebody says they have an aneurysm, the question is, what size? And again, you don't even think about underwriting someone until you know what size. So there are certain diagnoses you really want to know. I have asked the question about MRIs. Have you ever had an MRI? It's a very general statement, but it gives you a lot of information. It tells you what joints are bothering them. And then it can, if they say, oh, I had an MRI of my back. Okay. And then it takes you that leg, right? I had an MRI of my head. Well, MRIs of heads are scary for underwriters because a lot of people show what's called white matter changes. White matter changes could be indicative of MS, of early dementia, or that they may have an earlier sign of dementia in life than the average population. So generally speaking, insurance companies aren't particularly fond of white matter changes. Now, companies will insure white matter changes given that they don't have any other symptoms that they come up with and their age and everything's good. So there are a number of companies that will still insure with white matter changes, but be aware, not all of them do. So it's asking about MRIs, especially for people who say they have migraines. If somebody says they're on a migraine medication, they typically have MRIs. Somebody has tinnitus or hearing issues, they typically have MRIs because they're going to look for tumors or anything else that might be causing these problems. And as soon as they have an MRI and they're over 55 or 60 years old, the potential for white matter changes significantly increases that could minimize their ability to get some policies. So that's always a good question to ask, and you'll keep it in your mind, especially around migraines and tinnitus and things like that that has to do with the ears or eyes, visual changes, anything like that. They'll do MRIs. And then I always ask a general question. When you go to the doctor and you have your lab work done, is there anything that comes out outside of normal, a little high, a little low? Because anemia, most people would not think of that as a problem, but anemia is a problem. Blood, whether it's too high or too low, can indicate significant illness and chronic illness. You have too many red blood cells, they worry about overclotting, right? So there are all kinds of things that just a little bit outside of normal that is not diagnosed as a reason for it, or is not getting better with treatment. You need to be aware of so that you can send it to the underwriters to make sure that they have those specific numbers. They have anemia. This is their number. This is how long they've had it. And all bleeding has been ruled out, right? So you can get underwritten by companies with abnormalities on either side of normal, but you got to be able to explain them, right? So again, let's say supposed to say, if you're looking for process-related tips or case studies. Oh, that's from you.
Yes. I'm encouraging people to ask you questions before I ask you all the questions.
Oh, okay. Okay, good. Yeah, so that's another thing to think about. So I always go through the blood work. Then I ask another general question, which is, Have you ever been to a doctor or physical therapist, had any x-rays or MRIs for any knees, hips, shoulders, necks, any joint, any problems with any joints? And most people will say to you, oh yeah, no, I have some aches and pains. But if they've never been to a doctor, then it's not an issue. But if they've been to a doctor, then you have to go to the next step, because a lot of times people go to doctors and the doctors say, why don't you go do some PT? And then they say, oh, you know what? I don't really need PT. I'm feeling fine. I can handle it on my own. Then they have this open-ended medical um, requirement from the doctor that they haven't fulfilled. They're not going, that's a test or a procedure that has not yet been fulfilled, and it will be a denial, right? So we have to get those things off the medical records. If a doctor says you have to have PT and you don't do PT, then you got to go back to the doctor and say, listen, I know you recommended PT. It's in my medical record. Can you please take it out of the medical record and and make it some note that says, I'm all better. I've recovered. I did exercises on my own and I've resolved, and it's no longer an issue.
Anything
And we
related to
see this
medical
all the time.
non-compliance, right? That's gonna
Exactly.
really
Well,
be one of the
it's not,
worst.
yeah. And I think it's really that there's something outstanding that hasn't been done that was supposed to be done. So, and which means in the insurance size, it's still a problem. If you haven't taken the medication or done the treatment, then why would it go away?
Right.
Right? So they don't understand, the insurance company is looking for that. And testing, I mean, you have people who go to the doctors and then the doctor writes, "Oh yeah, you can get an X-ray, you can get an MRI, you can have another blood test, you can have the specialty test, get a calcium test for your heart or whatever." And people get nervous all the time. They have a family member who has um, uh, dementia, and they go to the neurologist to get a mental status test early, right? And then the neurologist will say to them, well, do you have ever any problems? And then they'll say, well, I have trouble remembering names, you know, and they can mess up their medical records right from the beginning, right? So, um, there are products that 3 years you're not being treated for anything, and you can be approved with a memory impairment, right? So if you haven't been treated and you haven't been diagnosed even for a memory impairment in 3 years, there are still policies out there there's a policy that you can still get. Um, so there are, understanding and being very clear about where people are going, making sure that there's no tests that they have been recommended. And that's one of the questions I do ask. Are there any tests or any therapies or any doctors that you have been recommended by a physician to do and you have not completed as of yet, or you decided you no longer need,
I
including
just think
Medicare?
from my own experience, Linda, one of the big ones when we just think of like compliance versus non-compliance that I see is sleep apnea.
Yeah.
That tends to be, um, for one reason or another, right? They think, oh, it's just like a light suggestion from my doctor, even though I have this equipment that I was told to use every single night. I treat it more like an accessory or only when I have trouble breathing, or I flat out hate using it and don't want to use my CPAP machine, right? That one used to get people in trouble a lot,
A
in my
lot,
experience.
yes, yes. So, the thing is, you try to help people remember things that you wouldn't typically remember. So you can't just ask somebody, do you have any medical issues out there? It's like, they just can't remember. It's not that it's trying to lie to you or hide things. They just don't remember. I mean, I've had people who don't remember when they're talking about a spouse. I completely forgot. Did I mention that she had a stroke? I'm like, no, somehow that eluded our conversation, right? So, but asking all these other questions, it guides you to them to be able to answer the questions, so that you have the answers to be able to choose the right policy, based on their underwriting.
Make a
So,
super good point there. It's like, is somebody not divulging one piece of information or another really down to them not wanting to tell you, or are you not asking enough guiding questions to get them an idea of what you're looking for, right? Until you get to time of application, right? The
yeah.
more homework you do up front, um, look, if it's going to take more time right up in the beginning and the client's expectations are set that way, knowing that when they're finally about to finish the process, they're going to run into less snags, all the better. And I think you make a good point. Are we asking enough guiding questions to get people to remember things? If you have a lot of health issues going on, or you had a health issue 19 years ago that's relevant because it's inside 20 years, sometimes you have to be prompted to get that out to the surface. You don't think about it every
Absolutely.
day.
Yeah. And people, I think people are very optimistic and they have their aches and pains and then they put it behind them and sometimes people take medications and they feel like since they're on a medication, it's resolved the problem that they don't have those problems anymore, right? Or, they had a stroke, it was over, done with, they recovered, they have minimal symptoms from it. It's a non-issue. It's something of the past. They got beyond it. So it's just a very positive way of living. I mean, if we thought about every ache and pain we ever had, and every, not, but if you think about, it's just, uh, I think about my mom who must have 100 million different medical diagnoses at the point. But if you asked her, "How are you doing?" her first answer would be, "I'm good." And if they said, "Do you have many medical issues?" She'd probably, no, everything's all set, because in that moment, she's all set. And if you asked her if she was independent, she would tell you, yes, she is an assisted living who has an aide every single morning. But if you asked her, "Are you independent?" her first response would be, "Yes, I'm independent. I can take care of myself. I take care of myself with aides, but I'm still independent." So perception of how you know, answer questions and ask questions, a perception of people in and of themselves of feeling healthy and sound. They don't really focus on these things that have caused them, that insurance companies worry about. And that's the other, really understanding that it's not just about what they worry about or their doctors worry about, it's what the insurance company worries about. So that's what we're trying to help them figure out. And I saw that question of, what medications do you take this morning? You'd have to follow up with do you take any other medications during the day or in the evening? And are there any medications that you've been prescribed that you are not taking because they just didn't feel right or you didn't feel you need them? Right. So, because, they will give you an answer to your question, but it may not be the full answer.
I do like it as kind of an opener,
Oh, yeah, it's a great opener.
start with the
Yeah.
most familiar and recently experienced, and then we'll kind
Mhm.
of peel back the layers. I do like that.
Yeah, no, it's a great start, but you want to make sure that you keep going with that. And whenever they give you an answer of a problem, you've got to take it to the next level, right? So to ask more questions about, yeah, I've been to PT for my back. Well, did you ever have an X-ray on your back, right? Did they say that it was mild, moderate, or severe osteoarthritis, right? Did the doctor ever suggest surgery? No. So these
Yeah.
are, because again, that suggestion of surgery is a problem. I had a person denied, although we were able to appeal it. He had one knee replacement done. He said his primary care, he goes back. He makes a joke to the doctor. He says, "My knee feels so good. I think I'm going to have the other one done." Right now, he was just joking. The doctor put that in the medical record. He was denied long-term care because he had a pending knee surgery on the other knee. And then we had to go and we had to go back I had to have taken an x-ray on the other knee to compare with, a past history of the knee to show there was no change and have the surgeon write that there is no surgery pending and there is no way that I can predict if or when there would be a surgery on this knee in the future, a knee replacement, in the future. And we were able to get him approved. But, if there's something in that chart that indicates that a surgery is pending or maybe needed, yeah, it will be a denial.
And it's not even about going back on cases that have been declined by not going the extra layer to each
Yep.
question that you're asking. It's also, if you're only going to maybe layer 1, layer 1.5 of something that somebody divulges to you, there is such a high chance that you're going to pre-qualify and the underwriter's going to come back with more questions. And now,
Exactly.
yeah, thanks. I know we just sat down and did 30 to 45 minutes of questions about your health, but I didn't ask enough questions, and now there's more questions coming back. So we need to sit down and I need to ask you a bunch of questions again, and you need to study things about your medical history again, right? That lengthens the process as well. It's not just a bad outcome when somebody's declined and you have to pivot or appeal or something of that nature. You win some, you lose some. Some things are out of your control. But I think asking as many questions as you can so that underwriter just comes back with a response instead of more questions, where you can, really helps the process too.
Absolutely. One thing that, that we don't think about always asking, but I do now because international travel is so big, and people don't necessarily think about international travel with regards to long-term care insurance. So another underwriting question to make sure you ask is, do you plan to stay in the United States for retirement, or do you envision yourself living abroad? Because the last thing you want to do is get through an application and then they say, and then they read it, right? So they're reading their product and they say, wait a second, I was just thinking about it. I might want to live abroad, and you've got a product that no longer meets their needs. So and they wouldn't necessarily have even been stimulated on that concept until they read the contract, because it wasn't brought to their attention at the beginning. And they didn't really think about it until they saw it. So, something else to add to your underwriting is just, are they planning on staying in the United States, or what the potential is for them to go outside the United States? So, any questions?
Yeah, you guys, we get Linda here once a year for this session. She's a wealth of knowledge. She could probably do this session for 3 hours. So please ask any questions that you have.
Can I ask one?
Yeah, of course. Hey,
Absolutely.
Suzanne.
Hi there.
Go
Hi,
for
how are you? Um, got a decline for somebody who had a Chiari malformation, but he's working as a sheriff and he's fine. So I'm guessing it must be asymptomatic, but I'll find out more details. But have you had that come up? And if so, are there any carriers that you think would be favorable?
So, good question. So, whenever there are malformations, even, a lot of times people have um, genetic change, that they were just born this way, right? They just, sometimes they're born with something in their brain that just malformed, and these are not well received by insurance companies, generally speaking. Um,
Mhm.
the easiest ones to get through would be bankers, right? Because it's not going to ask something
Mhm.
specific. It's, very
Right.
simplified underwriting. They would get through an Equitrust bridge because they're great. They just have a
Right.
and they could also they would likely get through on a nationwide annuity as well, and the One America annuity, and they very well might later get through One America, because they just tend to be more flexible in their underwriting.
Uh-huh.
And so what I usually do when it's very specific and I don't know, then I would look at sometimes John Hancock with John Hancock, or Bright House, or One America, tend to be a little bit more flexible in their underwriting
Got
for
it.
yeah.
So it was, we actually applied with Care Matters annuity and got declined because the diagnosis code came up, but it
Mhm.
didn't come up in going through the questions. There's nothing in any of the medical questions that
No,
asks that.
no, no, there wouldn't be. Like, that is so specific. There are always going to be some things
Right.
that, but if you had asked if he had ever had an MRI, that's a
Mhm.
very general question. It might have come up because it's likely that's something that is followed over
Right.
time,
Uh-huh.
just to make sure that there's no change in those malformations. Oftentimes, even if it's like every other year or something like that, or he
Uh-huh.
may say, I used to have them, and after 5 years of no change, they just stopped doing them. But
Mhm.
in order to find something like that, it would have been found with an MRI. So then the question is,
Right.
you know, yeah.
Right. I'm hoping that if I believe he's asymptomatic, but if that's the case, I don't know if there's any challenging it. We're going to obviously try to challenge it.
What was the name of it again? Was it called
Um,
again?
it's Chiari malformation. Let me spell it for you. It's a weird one. It's a brain malformation. It's on the spelling.
Hmm.
It's Arnold Chiari Chiari malformation.
Okay, yep. Let me see.
I mean,
And
the person
it
works as a
is-
sheriff. He's working, so he's clearly, and he seems fine from we talked to him on Zoom. So he doesn't seem to be.
Right. So here's the thing. So what it is, for everybody. So, and this is what I do. I often look up to see what it is and what the issues are. So, it is it's a malformation when the brain tissue in the lower back of your skull goes into your spinal column. It's a structural problem with your skull that typically causes it. And then, and so you can have headaches, which are usually a typical time when people find it. Um, and it can end up to having difficulty with balance and coordination. So
It
in
has a type
surgery,
1 and type 2, like diabetes. That's interesting.
yeah,
Um,
yep. So, but generally, um, you know, see, I'm wondering if it says if it can get worse. No symptoms and 2 major symptoms. And I wonder if it can. Many people don't have symptoms, but some people develop. So here's the problem, right? So whenever you see something like this, you may not have any symptoms until adolescence or adulthood. Many people don't have symptoms, but some people develop. So that's the problem with these types of illness, that if you have this problem and then some of these people are going to develop something significant like balance issues.
Right.
it, this is not going to be something that most carriers
Right.
are going to take a risk with, because they
Right.
don't, if they said that you would have a diagnosis and symptoms would show up by the time you're through adolescence, then they could say, okay, well, he had the malformation. He's now 40 years old or 60 years old. At this point, if they haven't showed symptoms by the time they're 60, they're free and clear. But that's not
Right.
what the data says. So then you say, okay, this is a diagnosis, and you don't make him crazy about it, but you said, underwriters are very strict, and they don't, you got to remember, they look at a pool of people instead of individuals. And I know how great you're doing. But let me tell you what companies are more flexible and look more liberally at this diagnosis. And so then you'll end up with definitely with, how old is the person?
65.
Okay. So if they have assets, you definitely have the Equitrust Bridge, right? And you definitely have bankers. And then as I said, it's unclear whether, like One America, Bright House, or like John Hancock would do that. And so I would ask those three, and see if you have any more flexibility. And then that you have those two that you can get, because he's obviously cognitively intact and he's obviously physically
Right.
fit. He doesn't have any symptoms. So
Right.
those other two would be easy underwriting, and he could get the preferred rate with
Got it.
Equitrust Bridge.
Got it. Thank you.
I love that you asked that, because this kind of goes to show like a slice of life of working in long-term care and insurance, right? You're going to run into conditions you have never heard of or encountered before. But I think it's important, at least to start, to figure out how to ask the right questions, because even though we don't know what the condition is, we still have to ask the right questions about it so that we can give that extra information to underwriters. Look at the condition, look at what the symptoms are, look at how it, potentially manifests over time, and think like an underwriter. You've done this enough times. What are they looking out for? Like Linda said, there's potential for progression of the condition later in life, though many people can be asymptomatic for years and years and years, right? It's spinal and cranial in nature, which tends to be hot buttons. So you'll want to ask about anything in combination. What symptoms are they experiencing? Things of that nature. So I think that was just a great case study. And even if you don't know what the condition is, you can kind of, pick at ways to find the right questions to ask to take care of that ahead of time for the underwriter.
Thank you. Yeah, it's funny. I had actually heard about it. I knew somebody who had it, so it wasn't totally. But so Linda, do you ever get ailments or different conditions that you've never heard of, and then you just
So
do
sort of
it on
like
the
that one that
spot?
you had, like I've actually heard of that
Yeah.
one before. But I didn't remember it. But when I get them, I immediately put them in. Like I'll be with them, and they say, "Oh, I had this blank blank." And wait a second, let me just look it up a little bit, and I'll look it up. So as soon as I saw it was that could come about almost at any age, right?
Mhm.
That's the biggest problem. Like, is this something that's
Right.
static? They have a malformation. There's no symptoms, and no symptoms will ever develop. Then that's a whole different situation, right?
Right.
But if it's something that could cause a problem in the future, that's the first step. And the second
Yeah.
question is, what kind of problems could it present? And if you're talking
Mhm.
about balance, cognitive,
Right.
those symptoms that could develop in the future are not going to be welcomed by underwriters, right? Those are
Right. No, I
scary
hear
things
you.
for underwriters to hear.
Definitely. Thank you so much.
Yeah.
Hey, Linda, while we have a minute or two, I just want to, um, you have a very extensive form questionnaire on your
I do.
website that you have people fill out. And I think
Yes.
it's great for a number of reasons. One, which I'll get into in a second, you ask a lot of questions that people just plain are not asking out there. Two,
Correct.
you take care of this as many times as you can through the form electronically. So it's not a situation of course, it's still work to get through, but you are not sitting there staring at them most times when they are kind of trying to figure out and answer this information. So I think there's nowadays an increased comfort in that. And number three, I don't think there's anything left unanswered on this form. And the piece that's in person is you kind of driving home the point that this is going to save us a lot of time. There's questions that need to be asked. The underwriters are going to find these things out anyway through medical records, and we're taking care of it in the most efficient way we possibly can in the comfort of your own home, filling out the
Yeah,
form,
absolutely.
right?
The other thing about the form is that what I usually do is I'll send when somebody says they're interested in an appointment or a financial planner introduces me to someone, I'll send them an email. I'm really looking forward to helping you evaluate your options for long-term care planning. Uh, if please schedule a time at your convenience. Here's my link to schedule a appointment. If you would like me to be prepared with a table of appropriate options for you, ready for our first meeting, please complete the HIPAA compliant questionnaire. And most people, I would say it's really, really high. I'm trying to think the last time that somebody didn't fill out that questionnaire when presented that way, because everyone listens and go, "Oh my gosh, well, of course I want the quotes, right? I want to know how much does this cost and what are the options out there." So of course I'm going to fill out this form so that I can uh, get the information the first time I talk in a meeting.
Yeah, I'm
So
sure that goes a long way. I just want to again, if you want to see how it's done, I highly recommend checking out Linda's form. Please do not submit the full form, but you can
yeah, you're
walk
welcome
through
to go on
it.
the website, of course.
Yeah, you can walk through it and get a sense of the questions that she asks. But there is one page that's so important and really gives the lesson that field underwriting is not just about health, though a lot of it is. You ask a lot of financial questions that I think are very important that people just aren't asking. Do you own or rent? Do you have a second property? I love that question because that already kind of establishes a resident state sort of scenario. Which one are you living in most often? Do you plan to retire at the second home? Is it just a vacation home? But what state would you expect to retire in? What other insurances do you presently own? A lot of some of these are from the personal worksheet. Some of these are, just really, really good planning questions. Do you have an HSA account? Do you own a business? On a scale of 1 to 10, what is your level of concern that you may spend the premium dollars and never need long-term care? Kind of feeling around for product preference, right? Between traditional and hybrid. If you had to take a guess, when do you think you might need care? I love the way that's worded. How many years would you want to be sure you could afford to fund if you did need care? And what do you feel you could afford on an annual premium basis if you were able to see the value? I think the way those questions are worded are great, but some of those questions get at things that you will eventually want to find out that you can get upfront. Like where is the client at today? How are they feeling without having this full-blown conversation with you yet can tell you a lot. And they're more willing to kind of give that answer if I'm just at home on the couch on my laptop filling out the form, right? I just think that's so important.
If you don't ask those questions, then how do you put together quotes? Like I wouldn't even know, like where do I even start, right? So if I know how much they make, I know how much they've saved, I know what's in their retirement, I know their property situation, I know if it's important to leave money to their children, I know it's their feelings on leaving of spending and not using the product. I know if they own a business or don't own a business and all that stuff. Then it gives me tons of information so that I can say, well, they don't have a lot of money. We're probably going to go for shorter policies. Probably going to have to go for a little bit more death. Let's look more in the NGL 222 annual premium rate, right? They don't have or they've got tons, they've got a lot more money. Now we're going to think about more like single pays or 10 pays or something like that because they can afford those and get them out of the way. They'll be much more likely to appreciate the value of cash and willing to pay extra money to have that added benefit of cash, right? So in terms of monthly benefit, in terms of duration, all those things are going to be spurred on by those questions. Also, when you expect to need care, most people will put between 80 and 85, but every so often you get people who are putting 90 plus years old that they expect care. Well, once you get to 90, the 5% compound on almost every company looks better. So, I would show policies differently for somebody who says to me, everyone in my family's lived to 100 years old. They're not using long-term care until age 95. Then we're going to look at 5% compound where you're going to really see the value kicking in over the age of 86.
Yeah, and it brings up you ask about it explicitly as a medical piece, but it also gets to the family history part of that. Do you have a family history of longevity? You ask about cognitive illness, which is often what we think about in, folks that have a family history of longevity, but just knowing the longevity is such an important financial planning piece. You have much longer of a retirement to plan for than the average person, right? And therefore put yourself at more and more risk of using up that retirement and the effects that extended care can have on it. So I just want people to understand, whether you're watching the recording here today, you're an old pro or you're new, field underwriting is so much more than health. Health is the complex part. Health is the part that's going to be very, very different depending on who you're in front of. But, it's like Phyllis says, when she works with clients, I would get in a lot of trouble if I started signing people up for asset protection when they didn't have any assets to protect, right? It is actually my duty to make sure that this is suitable for you financially. And how can I know what level of suitability we're at if I don't know where you're at, right? So yeah, I think that form is wonderful. Use it for inspiration. It's going to capture pretty much everything you need. And I think you add something new to it every year.
Yep.
Anybody else have questions for Linda? Well, Miss Linda, I will allow you to address everybody as kind of a wrap up, but I know there are more topics we can have you on for related to this side of the business. We talked about Pathwork. I know you're going to be evaluating that. We've seen it as a very, very slick and efficient tool for underwriting, but also you're just a expert on the claims side, the appeals side, diving into medical records. There's a lot more where we can go with this, but I love just this session around learning to ask the right questions because it affects so many pieces of your business. So is there anything you want to say to leave the group with?
So no, just feel free to use the form, for you to look at the form, and it's a process. So the more you do it, the more comfortable you will feel. Do not feel uncomfortable asking these important questions. It actually increases your professionalism. People want to actually be asked these questions because it means you know your business, that you're going to guide them more accurately than other people they may be speaking to. I have won a lot of business from people who have come from another financial planner, or another agent who has given them quotes. And I start off by saying, let me ask you, did they go through it? Did they, before I, give you any comparisons, let me ask you, did they ask you about your health? And many times the answer is no. And then I start off with, well, to be honest, I don't even know if they can be offering the products they did. Let's go back to the beginning, right? Did they ask about your income or your assets? No, well, how do they know what to even present to you, right? So it increases your professional level, and as soon as you come in as a professional, the other agents go away, and they are with you, and they will go the whole way.
Yeah, appreciate that. It separates the pros from the pretenders. And the only way to continue to get better at this is to just keep meeting with people and keep running through the process, right? I mean, everybody here has case studies that are only accrued from getting out there and meeting with people and learning about different situations and, getting an uncanny level of medical knowledge for somebody who does not work in medicine. That's what it's all about. You just got to keep getting your reps, just like anything else.
Right. And I don't know if there's anyone on here that sells bankers. There's not a lot of people who can sell bankers, but if you do have an underwriting concern and you do want something that basically says if you haven't had a treatment or a diagnosis in the last 3 years, and that's where you are, then I can help you with that.
Appreciate that, and appreciate everything you do for this community. Probably, you and Rhonda are probably close to tied for most prolific speakers on the study group, and
Hi,
every time
buddy.
we love it. So appreciate you very much, and appreciate you all for being here. And we will see you this time next week. Take care. Have a happy 4th of July if we don't see you on Thursday.
Thank you.
Thank
Bye-bye.
you. Bye.